challenges. I'm sick and tired of Zoom as much as you all are. In fact, I can't even stay for the whole program. I've got another Zoom at 10 o'clock. The Senate Rules Committee is meeting, and we've got some important work to do. But the challenges we have been compounded by the workforce shortage across the board, and by this ever-changing environment. You know, we have to buckle down and stay focused on our goals. And really our goal remains the same: to meet people wherever they are and to provide them the services they need to live the best life they can, whether they struggle with a disease of the mind or with an addiction. We've got to help people figure things out. That means we have to be committed. We have to be committed to completing implementation of STEP Virginia, a program we started a number of years ago to radically remake the services that are available in our communities. We have to be committed to the notion that people in every corner of the Commonwealth can get the services they need. Will remain important, I think, as we move on. You know, this is our dose of telemedicine. We have to continue, and I've seen in the General Assembly this past year, the Senate met in person while the House met virtually, but it was very refreshing that people could engage with the General Assembly by Zoom, no matter where they were in Virginia. They could be sitting in Abington or Cape Charles or anywhere in between, and engage with the General Assembly and have just as much impact as anybody else. And that was refreshing, and we have to keep that part of this Zoom life. We have to be committed to building a workforce that is essential if we're going to really complete this STEP, Virginia, and be able to provide the services contemplated by the STEP. You know, we started in this year's budget, our loan repayment program we've been talking about for a long time. We have to finish that out. We have to fund it fully. We've got a lot of work to do to make sure that it's utilized. We have to do a better job of making sure that the necessary work that you do is financially rewarding, and that you will choose to stay with this work for your career and choose whether it's providing services in the community or providing services in institutions. We have to make sure we have a workforce that can provide the service. We have to make sure that our work environments are nurturing, that they are safe, that people can learn and grow as providers within the workforces that we have, within the workplaces we have. We have to be willing to grow ourselves, to accept the change that's all around us, the change that better allows us to serve the people that we have to serve. I want to thank you for all that you do. I want to thank the department. I want to thank everybody in every corner of the Commonwealth that's doing this very important work. I hope this symposium is productive, and I hope that you leave here with a renewed sense of purpose and a renewed sense of ability to provide the service to the people you need. You know, when I was a very young lawyer, I would attend CLE conventions all the time, continuing legal education meetings, and I'm still required to attend them. But it was for probably the first 20 years I practiced law, I didn't, you know, when I went to a CLE, I always took something away that benefited me in one of the cases I was working on right then. And you know, I've kind of gotten away from that, you know, after so many years of practicing law. I guess you think you know everything, but I still try to remain open to the idea that I can grow as a lawyer and grow as a legislator. And I hope that you will maintain that sense of openness to change and openness to growth. And I hope that you will leave here committed to providing services to people in every corner of the Commonwealth. You know, I know the work you do is hard. I know that sometimes it seems thankless, but there are people out there that are counting on you. And I hope that you can count on us to make your jobs easier, but make them more fulfilling. Thank you so much and have a good day.
Senator Deeds, thank you so much. We really appreciate your words on improving the system and on workforce and implementing STEP Virginia. We do have a lot of work ahead of us, and we appreciate your partnership and your encouragement. Thank you very, very much. So now I'm really honored to introduce our next speaker, Dr. Janice Underwood. Dr. Underwood was appointed by Governor Northam to be Virginia's first cabinet-level Chief Diversity Officer. This position is also the first of its kind in the nation. Specifically, Dr. Underwood has worked collaboratively to build the One Virginia mission. This is the first ever statewide strategic plan for inclusive excellence across over 100 state agencies and with other public and private sectors. It's a roadmap for building diversity-led innovation in local, state, and federal government. And her goal is to make Virginia an exemplar for the nation regarding diversity, equity, and inclusive excellence. Thank you very much for being here today, Dr. Underwood, and over to you.
Thank you so much. And thank you, Megan, for that kind introduction. I'd like to formally recognize Commissioner Land, my esteemed co-presenters, Senator Deeds, Mindy, Carlin, and Jennifer Faison. Today we have come together in support of DBHDS's 2021 Behavioral Health Symposium, Strategies to Advance Equity and Reduce Disparities in Virginia's Behavioral Health System. Well, before I dive into all of that, I'd like to level set with you together that Virginia policymakers and many of us on this call have accomplished so much in 2019, 2020, 2021 in the fight for equity. And as a result, we serve as a case study for the nation. In fact, the legislative, what I call #DiversityWins, are too many to recount here today, but there is still so much work to be done, in particular at DBHDS. So I hope that as I frame the larger, more macro equity initiatives across the state, that each of you will dive a bit deeper into how you can implement or expand upon these ideas and initiatives in your sphere of influence, in your context. So just to be clear, I view my remarks today as a call to action for you, not only in the conference, but going forward. I'd like to share our why. Why? I've reflected on the title of today's conference. I reflected on the last 18 months in the Northam administration and in this COVID global pandemic. As many of you know, when COVID-19 hit Virginia, the first ever health equity working group and health equity task force were established to really thread equity into the COVID-19 response and recovery. And if you want to learn more about this group of what I like to call unapologetic equity champions in our mission, I'm going to put a link in the chat to the equity task force. I encourage you to capture that for later review. The reason why that's so important is that even before we had our first COVID case in Virginia, the governor, state health commissioner, Dr. Norm Oliver, and state coordinator Curtis Brown already knew back in January that based upon what we understand as structural inequities in healthcare and other systems, that this pandemic was going to disproportionately and adversely impact underserved communities. And during this unprecedented public health emergency, we also saw, or rather what we couldn't unsee, was the murder of George Floyd, the disproportionate positive cases, hospitalizations, and death rates from COVID on communities of color, and the string of AAPI hate crimes, which all somehow finally convinced many of us that structural racism was the larger public health crisis. And this larger, more macro crisis had proved more deadly and thus killed or harmed far more people over the last 401 years in our country than COVID-19 ever could. The task force knew that there would be a vaccine to COVID-19 long before there would be a vaccine to structural racism. And then it happened. In December 2020, the nation had a vaccine for COVID, but not a cure for that larger public health crisis, structural racism. So how did we get here? I'd like to just take us down a recent history lane. In 2007, I'm going back a little bit now, the Virginia General Assembly formally apologized for American slavery. slavery. In 2019, we commemorated the 400th anniversary of the arrival of the first enslaved Africans to Virginia. And in 2019, we were really reckoning with race and our incomplete knowledge of racial oppression. And we then created the first position of its kind, Chief Diversity Officer. In the summer of 2020, Governor Northam declared Racial Truth and Reconciliation Week, which led to a historic special session for racial equity and law enforcement reform. Now, in 2021, the Commonwealth of Virginia took more gigantic steps, too many to actually enumerate. And in addition to all the huge wins since 2019 or even 2018 and beyond, in addition to those, like abolishing the death penalty, legalizing marijuana, increasing civil rights for marginalized groups, I'd like to highlight a few, specifically House Joint Resolution 537, which declared racism as a public health crisis. House Bill 1993, which mandated all state agencies create a diversity, equity, and inclusion plan. And Senate Bill 1296, that makes that health equity task force that I mentioned earlier a permanent structure in emergency management. Since May 2020, the Health Equity Working Group and Task Force, the Commission to Examine Racial Inequity in the Virginia Code, the state NAACP, the Virginia Legislative Black Caucus, and countless other groups, many, including some of you on this call, began to advocate for many of these equity mechanisms, especially the statewide declaration that racism was a public health crisis or emergency. I'd like to publicly acknowledge the leadership of Delegate LaSharice Ayer, Delegate Alex Askew, Senator Lionel Sproul, among so many others who led the way for many of these equity reforms. Make no mistake, treating the root cause of structural racism, white supremacy, has proved more difficult than finding a vaccine for coronavirus. But I assure you, Virginia is ready to lead a national conversation and the necessary policy and social changes our state and nation needs for individual and collective healing and restoration. But what does all of this mean for you and behavioral and mental health? In the chat, I'm going to put several links to several resources that I'd like for you to capture and review as you matriculate through the conference, and even as you reflect on ways you can expand this work in your local office programs and outreach. First, I point you to House Joint Resolution 537. I hope that's in the chat box. As you read this, and I really encourage you to download this on your break, so that it can frame the rest of your conversations, carefully note three important areas: the definition of racism and its intersectionality with social determinants of health, which in my mind is consistent with the definitions in the One Virginia Plan, the definition of crisis, and the steps recommended by the General Assembly to begin to address this health crisis. Secondly, as a result of House Bill 1993, all state agencies must create and maintain a DEI plan. The One Virginia Plan, as Megan mentioned earlier, and the resources therein provides a template, a supplemental online toolkit of resources. These all were launched earlier this year to support DBHDS and all state agencies. And let me be clear, other public and private organizations who also were interested in fostering diversity-led innovation. I invite you to capture the link in the chat today to learn more about how you can leverage these resources in your context, because see, improvements in workplace culture, recruitment and retention, and engagement just won't happen simply because you wish them to. You have to do the work and measure it and be accountable to it. You have to change your informal and formal processes. You have to do something different than what you've been doing if you want to see different results. Please, I invite you to download the One Virginia Toolkit. Lastly, I want to share that the Equity Task Force realized that there was a problem with just simply declaring racism as a public health crisis, because as you know, So many people still think that racism either doesn't exist anymore, is not a problem, or they would just rather have you and me ignore it. But the truth is, we know there are contemporary manifestations of racism today in systems of criminal justice, healthcare, housing, education, and in particular, behavioral and mental health, because systems of racism never went away. They just evolved. It's no longer slavery. It's no longer Jim Crow or Black codes. It's more like James Crow Esquire. These are systems where it's a little more nebulous, a little more insidious and sophisticated, and so embedded in our systems that it becomes almost un-American or confrontational to even point it out. So in reaction to the declaration of racism as a public health crisis, the task force created a mechanism that makes inequity visible, less nebulous, less insidious across many of the social determinants of health listed in House Joint Resolution 537. And then I just want to share with you these dashboards for which I have put the links into the chat, are both a celebration of how Virginia has allocated resources during COVID-19 across many of the social determinants of health and a cry for action across those social determinants of health. So these dashboards make inequity visible and in reaction to House Joint Resolution 537. The first one, the Equity in Action Dashboard, celebrates the resources that we've allocated across the COVID response. It celebrates the work we've done to help vulnerable communities, many of the same communities that you're fighting for, that you're working with, and that you're trying to serve as a bridge for. We know that they've been experiencing food insecurity. Many of us have benefited from Medicaid expansion or PPE distribution. Please, I invite you to look at the Equity in Action Dashboard. On the other hand, the Equity at a Glance Dashboard is really that call or cry to action for us to examine ourselves, to figure out what we're going to do about the inequity we can now see. This dashboard says without bias where the undeniable equity gaps are. Let me be clear. Data doesn't lie, people lie. They are synthesized at a state level, at 133 local levels, and by race and ethnicity. These dashboards don't measure health outcomes as many other state health equity dashboards do. Instead, they synthesize social determinants of health, which, as I shared with you, is another way of saying racism, and that are consistent with the social determinants of health listed in House Joint Resolution 537. As I've said, I put a link in the chat box to both equity dashboards. We're presenting these dashboards to you today and to all public and private stakeholders around the state, because we're hoping that everyone, including leaders like you, will begin to see that these dashboards can help you with decision-making and allocation of the unprecedented funding that is or will be flowing into Virginia, especially funding that has the words racial equity attached to it, or how we're going to support communities underserved, underrepresented, under-resourced. So please allow those dashboards to guide your work and your conversations, especially as it relates to equity. In closing, I just want to say, if you don't remember anything else I've said today, and I know I've said a lot, remember this: talking about race and racism, talking about inequity and racial disparity doesn't make you racist. It's not divisive. Instead, instead of pretending that racism doesn't exist and pretending that somehow it's not relevant in your work, actually, that's the divisive part. We have to come together. We have to face our history and tell a more complete story of our state and our nation, and then we can heal. Then we can have true reconciliation and move forward. We must reject this colorblind mentality of our systems. Systems that have been built inequitably on purpose, and yes, that includes our behavioral health and mental health systems. Structural racism makes every other form of oppression possible. And that's an important point to talk about today and going forward. It provides a new understanding. So the Office of Diversity, Equity, and Inclusion is interested not only in ways that racism manifests in our physical and mental health, healthcare, and health outcomes, because health equity cuts across many sectors and how we live. We're also interested in working with you, kind of bumping elbows with you and building bridges and synergy and momentum in pursuit of service to 8.5 million Virginians who need us. Virginia is leading the way and is an exemplar in so many ways. But as I said at the top of this talk, there's so much more work to do. And honestly, as many of you well know, the Commonwealth of Virginia hasn't always gotten it right. But now we have a chance, an unprecedented chance to get it right now. The DEI field has historically lacked accountability. It's the only field where it's okay not to meet benchmarks. In Virginia, every state agency now has to submit a DEI plan. And these dashboards are part of that. We will be making an account of who submits and doesn't submit our DEI plans or your DEI plans, because ultimately our business goal and business strategy is to make Virginia an inclusive state where all people can live, learn, work, play, and thrive. And if we're going to do that, we have to hold ourselves accountable, and that's never before happened in the Commonwealth of Virginia, true diversity-led innovation. As we have declared racism a public health crisis, this is another way we must hold ourselves and policymakers and agency leaders accountable, and I mean all of them, for this important structural work. On a final note, we're also hoping that as we operationalize equity in Virginia, that you can learn how to center these practices in your spheres of influence, your policies, formal and informal practices, and most of all, in your conversations. Thank you so much, and turning it back over to you, Megan.
Good morning and welcome, everyone. Thank you, Dr. Underwood, for those phenomenal words of inspiration, getting us ready for a day of DEI conversation. So I am Dr. Tanika Mobley. Zoom tried to keep me away, but I refused to let it. I was tenacious and pushed through. So I am excited to be here with all of you today. Hope you have your energy level up, because I came raring and ready to go. I am really excited. I have the pleasure of introducing Commissioner Land. She is the Commissioner of the Department of Behavioral Health and Developmental Services, my supervisor. And so I've had the wonderful opportunity to get to know her, see her firsthand, the work that she's doing for our agency, her commitment to DEI as she tries to push us DEI forward with our initiatives and with her support. Commissioner Land was appointed by Governor Northam in December of 2019. She has been supporting state facilities in their battle with COVID-19, while simultaneously dealing with the additional challenges that we face as an agency, such as state hospital census crisis, the Department of Justice settlement agreement, and implementing our STEP Virginia plan to bolster our community services. Before her appointment, before being appointed to DBHDS, she was the Vice President for Behavioral Health Services for Centera Healthcare. So Commissioner Land, I hope you're ready. We're excited and we're looking forward to hearing from you.
Good morning, everybody. Can you hear me, Tanika?
Yes, ma'am.
Okay. I also want to extend a warm welcome to everybody, and thank you for being part of this 2021 symposium. And we've really been excited about talking about this and exploring this topic of equity with you. Now for over a year. Our last year's symposium was canceled, and we had planned to cover this topic last year. So we're so excited to finally be able to move forward and share this topic and the learning and all of the great speakers that you're going to have this morning and this afternoon. So throughout the pandemic, the need for this work to improve diversity, equity, inclusion has not only remained relevant, but has become even more urgent in our conversations within our agency. And so I'm going to take a few minutes this morning to talk to you a little bit about our recent efforts to dismantle the inequity and to center DEI as a core focus of our agency, both in our workforce, our policies and procedures, and additionally within the broader behavioral health and developmental services system of care. And so we're really trying to implement a lot of activities and initiatives that are going to help even the broader system of care, not just within the agency. So next slide. Okay, so the first step that we took to expand DEI initiatives in the agency in a really formal way was all the way back in 2008 with the establishment of a Cultural and Linguistic Competency Office. And that effort was really successful and effective for many years, but we actually lost key staff members, and we were not able to sustain that loss or maintain the momentum really across multiple administrations. So other informal efforts also arose across time to address the diversity and equity issues. For example, many of you are very familiar with our Partnership for Equity Advisory Committee, or PEAC is what we call it, which is a voluntary group of both DBHDS and CSB staff who promote wellness and behavioral health equity through things like education and training, and really strengthening our partnerships among DBHDS, our CSBs, and other community stakeholders and organizations. We actually started back in February of 2019 with a more formal and enduring effort to accelerate our initiatives. And then last year, we even accelerated those, as Tanika mentioned and Dr. Underwood had mentioned, even more of those efforts over this past year. And as strengthening DEI is a key priority of the Northam administration, we found support to really finance and build more robust programs with an office director. Tanika is now our official DEI officer for the agency, and she reports directly to me and is a member of our senior leadership team. And so she's also our MC this morning. We're glad she was tenacious and was able to join us. But we do thank Megan for stepping in there into the abyss there to help at the very beginning. So she was selected to fill that role and has really been working hard. I know that Megan mentioned and Dr. Underwood mentioned that she's already been out working with key stakeholders and within all of the different divisions and programs within the agency to really start to work on reform and to look at all of our policies, procedures, initiatives, all of those with that equitable and inclusive lens. And as you can see in this slide, this lens interacts with all of the sections and divisions and areas of our agency and also the broader system. And so Dr. Mobley's responsibilities are going to carry over, as I said, into larger statewide efforts that Dr. Underwood discussed, like the building of the One Virginia plan and also our particular agency plan, and to increase DEI across more than those other 100 state agencies. She's actually partnering and working with them so we don't duplicate efforts, and we're all kind of moving forward in the, in lockstep together, hand in hand. Next slide, please. I'm sorry, I'm getting a little bit off my slides with a little bit faster. I went too forward. Ultimately, as you'll see on this slide, what we want to do is to ensure that we're all cultivating agency cultures that will move us forward toward optimal inclusion and getting to organizational effectiveness, while also becoming that employer of choice. That is going to be key to our workforce issues. It's important that we're all very intentional as we do this work and as we strive toward retaining and recruiting a diverse workforce that is filled with top talent at all levels of our agency and within the system of care. In short, the ways in which we hope to do that are by making sure we have shared accountability and transparency around improving processes that promote equity, as well as working toward establishing more diversity-led ideas around innovation and technology. Next slide, please. DBHDS is developing plans that are going to strengthen DEI efforts and create an inclusive culture of belonging across both our central office and our facilities, as well as with our community partners. And on a more granular level, I want to share some of the ways that DBHDS plans to be intentional in working toward building a community of inclusion and belonging, where equity really does inform the work that we do. I so apologize for that. I should have shut that off. I'm not going to talk in depth about all of the efforts, but I do want to highlight a few. As these plans progress, we'll also make more information available to you. So this past May, we launched a section of our internal internet that had a DEI focus. So we actually have a DEI page now. And this is where we post and host resources. Also, community events are shared. And it's really become a shared community space to connect us through information and idea sharing within the agency. For the central office and our 12 facilities, we're also developing an equity advisory council that also will report directly to me, and it's going to be launching this July. It's open to all employees. It's an opportunity to really build those bridges and learn more about how our workforce actually wants to be supported and included, and where we can invest in their growth within the agency. And then this summer, we're also, from a community events perspective, we'll be hosting DBHDS Community Conversations, which will be a quarterly series of virtual meetings. And we'll bring in community leaders, advocacy groups, and subject matter experts to discuss issues that are of interest that have been identified through the council for our workforce. We're also coordinating DEI efforts with human resources as we actually are looking at whether we have equity with our pay rates, workforce development, mentorship, and succession planning. So we've got a lot of activity going on there. We're going to be developing partnerships that allow us to extend our reach in recruitment efforts, professional development, and educational and wellness resources as well. So lots of activity going on. We're also partnering with the HR workforce development in our mission to diversify our workforce by bringing in high-level talent representing all of our communities within the Commonwealth. And we did establish an interagency employment coalition that included several other of the Virginia agencies. So the Department of Veterans Services, the Military Medics and Corpsmen Program, Department of Aging and Rehabilitation Services, so DARS, and also the Department for the Blind and Vision Impaired. So we're really working together to try to make sure that as we're building on workforce and the diversity aspects, that we are being very inclusive of all of those other agencies. We're also developing a Train the Trainer series to better connect our workforce to the DEI trainings and resources. And eventually, we would like to have many of these tools and resources be available to the community, public, and private providers. So for you guys as well. And so as we get those developed, we will make it accessible to you. So as you can tell, we're having lots of activity across our agency and system for our workforce and in service delivery. And so this is really, we're really looking to, and Tamika is really leading us in a truly comprehensive approach to meeting those needs. And we will build competency over time. So this will lead to greater competency. And so next slide. In November of 2020, we did contract with VCU Metropolitan Education Resource Consortium, and they are doing an equity review for us, and the outcome of which will be recommendations that lead to the strategic plan, the One Virginia plan, and will form on what the metrics are that we will be working forward to achieve certain goals, in the plan. It's in response that actually we developed this and did this contract with them for the engagement in response to concerns from our actual leaders and other staff about a lack of diversity in leadership here at the agency and about organizational policies and practices that they felt were leading to inequitable outcomes for our workforce. This slide does show many of the goals for this engagement, most of which I've already mentioned. But we wanted to first examine what are those actionable steps to address and mitigate the discriminatory recruitment, hiring, pay, and promotion procedures and policy. And so we did supply 5 years worth of data to VCU, and they are developing, they've analyzed that, are developing findings and recommendations on organizational diversity, retention and turnover, pay equity, and wage gaps that have been identified. And so we'll have those recommendations in these areas so we can actually set the goals and targets to achieve, to be sure that we're moving forward and making progress. And then future phases of this equity review by VCU will look at the policies and organizational practices, as well as contracts, all types of things within the organization that we believe may be leading to inequitable outcomes with our workforce. Next slide, please. In addition, there are several initiatives and programs underway as well that will have a significant effect on health equity. And many of you may have already be aware of some of these, but first, we've been working again with VCU to create a behavioral health index, which is designed to improve how we actually allocate the limited dollars that we receive and the funding that we pass through to fund the programs in the community. And that factor will, it takes into consideration the prevalence of stress-related conditions and various social determinants of health. So what we'll be able to do through this project will now be to amend how we have currently or historically allocated dollars, which were based mainly on population centers. So the higher the population, the more the money that went to that area. And then instead, we'll be able to spread our resources far more equitably throughout the Commonwealth based on where the actual need is. And so this isn't a change that will be very, very obvious and front and center to the general public, but it is still a big reform in the way that program funding, and so the ability to increase access in those currently underfunded locations. So there will be a huge change. This is a huge change for our agency and for our system of care. Next slide. We're also working closely with the Department of Medical Assistance Services on Project Bravo, which of course is the new name for behavioral health enhancement, and previous to that, Medicaid redesign. I think this is our third or fourth iteration. But Project Bravo, and as you're aware, along with STEP Virginia, is really a big part of transforming the access and delivery to behavioral health services in Virginia. And basically what it will do is ensure that the amount paid by Medicaid for a range of comprehensive services reflects the actual cost that the healthcare provider has to deliver the services. And they'll start with these 6 services that you see there in the middle of the chart. And then as part of developing that, we have several, as you see on the right, several external work groups are also providing input on factors like service definitions, the licensing and regulatory considerations, workforce credentials, those types of things. They're also, and I put a little arrow to kind of highlight it, there's a racial equity work group that's a subgroup of that, was also developed as an acknowledgement that the structures that pay for healthcare and behavioral healthcare services are subject to the historical and systemic racism that's part of the history of our country. And so enhancing this range of services, it's really an opportunity for us to dismantle those inequitable structures by opening a conversation about what that looks like and how we can really do better in this area. So that's going to be a really important piece of that as well. And then next slide. Another example of things that we have worked on and that are in process are the system-wide equity efforts in the Marcus Alert. And everybody, I think, is aware of the Marcus Alert. That legislation, creating it, was passed by the General Assembly last year and then signed into law by Governor Northam. And it aims to implement state and local protocols to reduce the negative outcomes that seem to keep occurring when the use of force is implemented by law enforcement during interactions when an individual is experiencing a mental health related crisis. So we also have a group, an external group that's guiding that implementation, and it's multi-disciplinary, multi-agency, multi-stakeholder. So across fields of the mental health, the developmental disabilities, law enforcement, social justice, racial equity, all kinds of folks are coming together on those work groups to make sure that that implementation is done correctly. And by December of this year, one Marcos Alert program will be launched in each of Virginia's 5 regions. So that's exciting. But then, and not too long, by July 2026, every one of the 40 CSBs will have Marcos Alert systems. So very exciting work there. It's definitely one that you want to keep an eye on and keep a watch out for. Once fully in place, of course, it's going to support that equal access to behavioral health services when folks are in a behavioral health crisis. And in particular, with a focus to ensure that access for Black Virginians, Virginians of color, and people with disabilities, which is really what all this work is about. Next slide. Okay, well, I'm going to just finish up here. That kind of concludes my slides and all, but I just want to thank you again for participating in our symposium. And I'm grateful to all the presenters who are taking time to share their expertise with us here today. And I also want to just take a brief opportunity to say that this past year has tested us, all of us, in ways we can never imagine. And I know this has been felt deeply throughout our system at the state and local levels. And now more than ever, I want to just say we appreciate the work you do to improve the quality of services for the people with behavioral health disorders or developmental disabilities across our Commonwealth. And thank you again for your tireless efforts, dedication, and your compassion. And I hope you enjoy and learn a lot today. And so, Tamika, I'll turn that back over to you now.
Thank you, Commissioner Land. I appreciate you sharing all the work that we're doing and again, supporting all of our efforts at DBHDS to move the agency to be DEI focused, equity centered. So we have some exciting work ahead of us and I look forward to our continued work together. So now we're actually going to transition a little bit and we're going to take some time to learn more about the DEI efforts at both the public and private community levels. And we're going to first hear from Jennifer Faison, who is the Executive Director of the Virginia Association of Community Services Boards. I've had an opportunity to speak with Jennifer. She's extremely insightful and passionate. Love partnering with her. She represents Virginia's 40 local community service boards and state and federal public policy matters, including state and federal funding, legislation, and regulation. Her work also includes working not just with our agency, but other partners to build consensus on policy, administrative, and operational issues that impact our community service boards. So we're really looking forward to hearing about her DEI efforts, because I know she's been doing some great work with the community service boards to support them in this work. So Jennifer, I'm going to hand it over to you to share some of the great initiatives that you've got going.
Great. Thank you so much for that introduction. And I'm going to jump right in. We're going to talk today about what is happening in our CSBs. What I did basically was ask the CSBs, if you would like to share what's going on in your local community, what you're doing internally, and how you're engaging your community partners, please, just send me a couple paragraphs. And I got a lot of great responses. So what I decided to do was kind of sift through those responses and give you all a feel for kind of where the community services boards are focusing as they continue in this work. And I did not hear from all 40 CSBs, but I can assure you that all 40 of them are working on DEI initiatives. And so I'm just going to kind of synthesize some of it, and then we'll talk about some of the detailed things that are happening and a little bit about the future and how we intend to maintain the momentum, because I think that's really important with initiatives such as this. So in terms of the most cited activities that you can see on your screen there, are really that's kind of what the CSBs who responded identified as their steps. And so, you know, when you look at the similarities, you know, these are kind of intuitive, and I think this list is indicative of the way in which, or the ways in which organizations go about solving problems or bringing on new initiatives. And so, you know, you have to bring focus to the initiative, which really means getting organized. So all the CSBs that responded said that, you know, they had created some sort of team or council to take this issue on. Not that there wasn't already work going on in many instances, but really to raise the profile of the work within the organization. And so a couple of the other things that go along with that is developing a mission statement. Statements of intent are important, again, because you need to have a touchstone, something to go back to make sure that you're keeping your work focused and that you're moving in the direction that you want to move in. And so, of course, you're going to have to figure out the scope of the issue and problems within your organization. So you'll want to engage staff to help with solutions, and then naturally, you'd want to support what you find out through training and educational initiatives within the organization. And I did want to mention that several of the respondents said specifically that they were engaged in formal independent equity reviews, because you know, this, in our personal lives, this happens as well. You don't always have accurate perspective on yourself. So it is often good to bring in an outside entity to really dig in there and make sure that you have an understanding of what is actually going on within your organization. So I wanted to make sure that I pointed out that. And there has just been an amazing depth and breadth of training and education that's been moving through the CSB system. Of course, racial equity, systemic racism, implicit bias, generational trauma have been the topics of interest that have been covered. What I was struck about, though, as I was reading through these little highlights that the CSB sent in, was the common theme of normalizing conversations about race. And I think, as always, Dr. Underwood at the top of this portion of the symposium really did help us focus on that. And, you know, I was reading a book recently that had to do specifically with Israel and Palestine. And there were two individuals who shared stories, an Israeli whose daughter was killed by a Palestinian suicide bomber, and a Palestinian whose daughter was killed by an Israeli police officer. And so in this book, one of the things that it's actually a bumper sticker that one of the men had on his motorcycle, and it said, "It will not be over until we talk." And I thought that that was such a powerful statement, and it really does resonate in this moment, in this time when we really do need to normalize conversations about race. And again, that was a common theme. And it also struck me that not only do we need to talk, it won't be over until we talk, but we have to figure out how to even talk about this. And again, I think Dr. Underwood helped us focus on that at the top of this hour, but that was one of the things that I was struck by as I was synthesizing this information for you all this morning. There were some common goals and objectives among the submissions as well. That included applying a racial equity lens to all of the CSB internal policies and procedures, and also examine and addressing racial equity in hiring, promotion, performance evaluation, and disciplinary action, which I think is again, it's a really important thing to do that examination so that you can uncover these things within your organization, because you can't address what you can't see. And they are striving for organization-wide competency in many of the concepts that we're discussing here this morning and that we will be engaged in for the remainder of the day. And then the other thing that's important, and I'll talk a little bit more about this in a second, but bringing those competencies to your service delivery was an important theme that was addressed as well. And when we're talking about CSBs, we're talking about multiple prongs in the way I think that Commissioner Land laid out. You know, it's not just, you can't just be looking internally. You know, one of the prongs that the CSBs, obviously they do need to do that internal looking, but the other is that, you know, the business of service delivery. And so CSBs have really recognized that they have to mind both of these and other prongs as well. And they have to support and prepare their staff to work together as an organization, but they also have to understand how racism, bigotry, bias, and all of these things impact the people that they serve, as well as the way that they deliver service. So that's a really important component of how the CSBs are going to approach DEI within their organizations. And then another side of it is this broader community engagement. So the CSBs are woven into the fabrics of their communities, and that they understand that their role is much bigger than just providing services. They're actually, you know, part and parcel integrated into their communities. And so they're bringing their DEI conversations out to the larger communities. And here are just a couple of examples of how they're doing that. One CSB held a community walk and talk event. Several have had panel discussions that include community member experiences. So individuals who are receiving services and folks in the broader community were able to come and openly share their experiences, which is all part of the learning process. And then we've, of course, had CSBs engaging in traditional and social media information, highlighting the issues that are related to the intersection of racism and mental health and racism and disability in general. Again, they're looking internally at their own policies and procedures and moving forward with their staff, but they have this role in the broader community that's important to understand as well. And with that, you know, I do want to talk about some of the creative things that are happening within the system in the DEI space. And I'll place one caveat on this, and that is that, you know, all CSBs are connected to local governments. Employees of our single jurisdiction CSBs are actually employees of the local government, so that's how close the attachments are. But there are CSBs that cover multiple localities, and they operate a bit differently and in many ways a bit more independently, more like a business. And I say that only to point out that some CSBs are participating in broader city or county-wide initiatives, and so that's going to drive their decision-making internally, is what is going on with that locality that they're so intimately connected to. And then others are tackling it independently of their local infrastructures, which means they're going to have a different approach and maybe some different kinds of flexibilities. And so, you know, as you begin to surface and uncover, you know, issues and things that you'd like to address within an organization, you know, the CSBs are moving forward to make changes. And just a couple of things that were mentioned, maybe not across the submissions, but, you know, in particular. And one of them was that Region 10 actually raised its minimum wage to $15 per hour. And I thought this was important because what they recognized was that while 30% of their staff were of color, 80% of those staff of color were in their lowest paid positions. And so this minimum wage increase was really, you know, about equity and focusing, you know, this is the kind of thing that you begin to understand within your organization when you're applying that equity lens to all of your internal practices. And so not only did they surface this information, but they took that, that step to raise the minimum wage within their organization. And I know Piedmont CSB in particular, but I know there are others as well. They are engaged in working with the One Virginia plan mission, as Dr. Underwood called it, and they are taking advantage of the amazing work that Dr. Underwood has done, and they're tailoring it to help meet the needs in their CSB. And so often in our lives, when we run into obstacles or challenges that we need to overcome, we say things like, well, there's no instruction manual for this. Well, in this instance, you have a very good foundational set of materials and resources in the One Virginia materials. And so Piedmont is taking advantage of that. And then another kind of thing, and as I was reading the submissions, this one popped out at me because not everything that happens or every step that a CSB takes or an organization takes has to be rocket science. There are some very deliberate and simple things that organizations can undertake. And an example of that is Valley CSB created a calendar of events to celebrate racial equity, social justice, and health equity. So it's not just a calendar. It doesn't just say, here's, we're celebrating, Autism Awareness Month or anything like that. It's that, and it's connected to some activities that folks can participate in support of the recognition of these things such as racial equity, social justice, and health equity. And let me do this real quick. Let that sit there for you for a second. I called out a few CSBs on the previous slide, and I did not want to go without recognizing the rest of the CSBs who submitted and that we talked about the common themes in there. I like my job, so I don't like to play favorites with my CSBs. And the last thing I want to talk about is really the role of the association in all of this. And we serve, the VA CSB serves as a way for CSBs to organize around issues. And of course, this is a natural fit for the VA CSB as well. And so some of the steps that we're taking, we have DEI on every single one of our agendas, and we'll continue to do that because, again, you have to keep the momentum. And if you're not looking at it all the time and keeping it in the front of your mind, you're going to lose steam. We are creating a DEI subcommittee of the VA CSB Board of Directors. And I don't know what they will decide to do as they take on some of the aspects of DEI initiatives. But I expect that we will come up with a learning collaborative and some deliberate things that we can do in support of our CSBs as they seek resources to implement some of the things that they're learning need to happen within their organizations. DEI is included in our training and development conferences, and we have a goal of including 2 additional trainings per year that are solely focused on diversity, equity, and inclusion. And then we'd also like to institute a 6-month check-in with CSBs, again, just to help them share knowledge and to make sure that within our own system, we're holding ourselves accountable for moving forward with these initiatives. And, what is important is the check-ins will also help us figure out what are we doing as a system with what we're learning. So we're uncovering things, and there are things that we know we're going to need to address in this space, but we need to make sure that we're checking regularly to see that forward progress. And one of the other things that occurred to me is that if we're thinking about diversity, equity, inclusion as a public health emergency, then really we can apply some of the things that we already know to dealing with public health issues. And we have a very robust prevention program and prevention system within Virginia. So I personally would like to see if we can weave DEI or create it as a separate prevention initiative, recognizing that prevention and early intervention are the best ways to help folks manage and to ensure greater outcomes at the end of your objective. Now, this work doesn't ever truly end; it's ongoing. Recognizing that, but it's exciting. I think your CSBs are committed to moving forward and to ensuring that they are doing the best and providing the best that they can for their staff, as well as the individuals that they serve and their broader community. So thank you very much for your time this morning. I know you all are going to do some real hard work and deep dives this afternoon. And we'll look forward to hearing from you all as we all progress as a system with our DEI initiative. Thank you.
Thank you, Jennifer, for not just sharing the work that you're doing, but also really laying the groundwork for some of the things that Dr. Brown's going to talk about a little bit later, some of the areas of DEI that she's really going to explore, as well as our speakers this afternoon. Really getting us ready to go today. So appreciate you taking your time to share this learning experience with us. So now I'd like to introduce our next speaker, who's Mindy Carlin. Mindy is the director of the Virginia Association of Community-Based Providers, a nonprofit association of private community-based mental health and substance use disorder providers. Last July, their board of directors approved the One VA CBP. The purpose of that One Virginia plan was that their merging is to advocate for policies to address racial and social inequities, to improve the outcomes of behavioral health services, and to encourage the development of policies for implementation by the VA CBP. So I just want to say on a personal note, I've actually only spoken to Mindy one time in my short time with the agency. And in that one conversation, her passion and her desire to really figure out how to create an organization that had inclusive excellence, creating an organization of belonging, one that really had an equity center, just really resonated within that conversation. And so I am excited to hear about what she's doing, because she really does exude that passion. And I know today, I look forward to hearing her talk about her accomplishments and the work that she's doing. So Mindy, I'm going to turn it over to you.
Thank you so much. And thanks to everyone for taking time out of your day to participate in this discussion and to really be committed to doing the work. And so Tanika was kind enough, you've really covered my first couple slides for me. So I'm gonna run through some slides. Obviously, I'm here to talk a little bit about our One VA CPB initiative. And to start, I know Tanika gave a little bit of background about our association, so I'll just really quickly talk about that. So our association, similar to kind of the Jennifer Faison's association that oversees the CSBs, we are an association of private sector organizations. So the common thread among all of the members of the VACPB is that they're all private sector and they all provide community-based behavioral health support, including Medicaid reimbursed services. So many of our members provide other types of services, ranging from residential to CSA funded services to arts to ABA, a real wide variety, but the common thread is that they're all private sector community-based Medicaid reimbursed services. We're a relatively young association. We were founded in 2013. And over the time since then, we've really grown to become one of the largest associations representing the interests of private sector behavioral health providers. We have more than 50 agencies that are members of our association with a footprint of more than 160 facilities across Virginia. Our members also range in size. We have members who have fewer than 10 employees, and we have members who have more than 500. And we have members that have just one location and some that have more than 30. So we really have a very kind of a diverse group that represents all corners of, represents and provides services in all corners of the Commonwealth. The basis of the work that our association does on behalf of our members is really focused on our 5 strategic pillars. We advocate, and those include advocate, inform, collaborate, support, and elevate. And I focus on elevate because when we talk about the work that we do to elevate our members as the gold standard, this is really where we place our One VACPB initiative. And so that's the way we think about it. That's the culture that we bring forward with that. So again, Tanika kind of gave you a quick history of this initiative. So it is, One VACPB is focused on fighting racism and promoting diversity, equity, inclusion, and justice. We are in the next week be celebrating our actual 1-year anniversary from when our board took the action and adopted a resolution to create this initiative, which really since that date in June of last year has, I have June of 21, June of 20, but since last year has really kind of led the development of the One VACPB initiative. So as we kind of approach celebrating our 1-year anniversary, I thought it might be most helpful to pull out some of the goals of our initiative and the efforts that we've undertaken toward advancing those goals to kind of give folks a flavor of how our association has approached and implemented our One VACPB initiative. So I'll start with kind of where we started, and that was prioritizing being an anti-racist organization. So among the goals of the VACPB, of One VACPB, were to acknowledge and strongly support the statement Black Lives Matter, to acknowledge, and this very much aligns with Dr. Underwood's previous comments, to acknowledge that racism itself is a social determinant of health, and we need to identify strategies to change that. And not only that, but again, drawing from Dr. Underwood's comments, that racism actually impacts all of the other social determinants of health. So I really liked the terminology that Jennifer Faison used when she talked about normalizing conversations about racism, because we spent a good bit of time and continue actually to spend time and attention on doing that. And as we got started, one of the themes that came forward from our members as we were prioritizing our work is to ensure that really talking and using the word racism and considering what that means and getting comfortable and sharing our experiences and thoughts and concerns and fears about racism need not be on a list of a bunch of other goals, that it really needed kind of that time and focus and attention. And that's why every time you'll hear me talk about One VACPB, you'll hear me talk about the importance of talking about racism. And don't get me wrong, we've had some really challenging conversations, uncomfortable conversations. But as I shared with Tanika when we spoke, I feel strongly that the real growth and change comes in getting uncomfortable. And so we've spent a lot of time with that. So as I said, early on, we committed to having those conversations, to being an anti-racism organization ourselves, and to push our members to do the same. And we provided a space for our members to talk about what their agencies were doing, what they were saying about this, and push them not only to come and participate in our discussions, but to go back to their agencies and continue to fight and be agents of change. And I really credit kind of the mother, I call her the mother of One VACPB, as a member of our board, our immediate past chair, Dr. Celissa Lambert-Woodard, who's the president and CEO of Pathway Homes based in Northern Virginia. And she really provided the impetus for the creation of One VACPB and has continued to lead that. Co-lead that initiative now. And so I'm here actually sharing the words, but I credit her with really what I just talked about. Was we created a safe space for discussion, sharing, and learning for our members. And among our goals here is to increase awareness of the systemic barriers and unconscious bias that disadvantage the Black community. We have other goals that touch on this as well, but early on understood that it's really that education had to be a foundational piece of our One VACPB initiative for our members and for ourselves. And so we provided that safe place where we could have those challenging conversations. I shared this with Tanika. We created ground rules even so that to try to, again, make folks understand and feel the comfort and the safety in being able to come forward with their thoughts and their concerns and their fears and their questions even. And one example I like to give is that when you are in a situation, when I would be in a situation, for example, where I would want to raise an issue or ask a question that I was a little afraid to ask, because I didn't want to offend someone or use the wrong word. And so we created the system that if you say first draft before you speak, then the others on the call in that setting will know that your intent is not to cause harm or offend, but it truly is in the interest of kind of learning and communicating. And so we really worked hard on that. We identified credible sources for education and information. As everyone, I'm sure who's on knows, that there are a lot of, quote, authorities on topics. And so those who or kind of my trusted and credible sources I rely on before sharing information. We created a reading list, a resource list. We even did some kind of reading assignments where we would read and between one meeting and the next, and then the start of the next meeting would really be to talk about what we read and what we learned, and we'd share an experience. And so we continue to kind of undertake that. The other thing I wanted to share that we are actually just getting ready to launch in the interest of kind of creating that safe space for discussion, sharing, and learning is what we're calling Teach, Talk, and Takeaway education series that will actually be launching next week. And so the focus, this will be a monthly education series where we will bring forward sources who will talk about issues and topics that are relevant to our members. We are looking at, I call them bite-sized pieces. So it'll be 45-minute kind of lunchtime thing where it's 20 minutes of, as you'll say, teach, then some time for discussion after that, and then 20 to 15 minutes for discussion, and then a real strong focus on takeaways for action. How can you convert and consider what the topic of discussion was for that series and take that forward in your life, to implement it, to share, to converse, as Dr. Underwood talked about, in your conversations, how you can take that lesson forward in some way, big or small. So we're really excited. The first session for this is going to be on Monday, and we'll talk about the history of Juneteenth and Loving Day. And Dr. Atasha Christian with Guided Paths is stepped forward and is one of our just amazing members who's co-leading our initiative. We have a range of other topics we're looking at as well for future, but this will be every month. And so we welcome those who might want to participate. The next thing I wanted to talk about is how we've worked to promote diversity, equity, and inclusion as an association. And so among our goals was to promote DEI, not only within our member agencies, but within the VACPB as well. And we learned that in order to increase the diversity of our membership, we had to understand our starting point. And we really didn't know. We didn't understand kind of how many of our agencies may be BIPOC owned or led, or because we weren't asking those questions. And so in order to really think about how to ensure that our association was a place that all providers felt that they could come regardless of their ethnic or racial or gender, regardless of any of that, we needed to really understand where those gaps were. And so we set forward to assess the diversity of our current members and leadership. And I want to say not only our members, but the voices at our table. The voices at our table. Our organization is very much an organization that is led from the member up as opposed to from the top down. And so regardless of what your position may be within your agency, anyone who is engaged in participating in VACPB initiatives and efforts, that is what guides the organization that we are and that we are working to be. And so it is very important to us that the faces and the voices around that table be truly diverse and inclusive. And so with that, we had to ask the question, what questions should we be asking And who should we ask? How should we define the responses? And how do we explain why we're asking these questions, recognizing kind of the historical context and fear about being asked about how you identify, what your race is, what your ethnic background is, and historically how that information has been used for bad. In this case, we wanted to use that information for good. And so it was really important to consider that. So what we learned with respect to this was that words matter, right? I mean, we know this, we say this, and we talk about intentional language, we talk about how we define words, but we realize that how we ask the question to identify what the diversity of our group was really important. And while I went into this really thinking that there was this kind of generally recognizable definitions and terms, there really aren't. And even, so we did our best, and I'll say it took us probably a month of discussion to kind of get to the right words and the right language. And I don't know that we did, if there is a definition of right, but we did the best that we could. And so, you know, even in looking, the focus of what our questions was on the ownership of where we started, the ownership of the agencies that were members, ownership / leadership for nonprofits, and then the same for individuals who are actively engaged in our association. Even when asking the question of race, we went to the census definitions, right? Thinking, of course, that's going to be accurate. And even with that, what we found, and I highlighted on the slide, that problems with that. So according to the census, in order to be identified as Black or African American, that includes a person having origins in any of the Black racial groups of Africa. We also learned that if you are of Middle Eastern or North African descent, then according to the census, you would check the box of white. And so we did our best. We added options for folks to self-identify if they felt that they self-identified with more than one race. Of course, they had the option not to answer or check the box additional race not listed. So we asked about gender identity as well, and sexual orientation, and had a lot of discussion about how owners of our agencies would feel about being asked about their sexual orientation. But again, the interest is and continues to be in folks feeling that this is an association where their voice matters and that we want all voices to feel comfortable and to be included. So the findings were, you know, we now know, we have a good sense of kind of where those gaps are in our membership. We had more than 2/3 of our members responded, which we were really, really pleased. We felt that that was really a very good response rate. And we found that the real gaps in our membership are in the areas of Hispanic owned and led, or Latinx owned and led agencies, Asian American, and Native American. And so we are now kind of thinking through and working on strategies to make our association a place where agencies or individuals in those categories want to come to work together, to work with their peers. And so that will be an ongoing effort. The next thing I wanted to highlight is an equity lens. So among our goals was to apply an equity lens to all aspects of our work, including governance, commitment, value alignment, et cetera. And so Dr. Woodard, Lambert Woodard, who I referred to earlier, worked with us to develop an actual customized equity lens tool, the vision tool. And so we have used that in a number of ways. We've hosted 2 sessions, 2 workshops over the course of the last year that provided an opportunity for our members and other providers to participate in actually practicing what is an equity lens, how should it be used, and to practice that with scenarios. And right now we are actually in the process of, our governance committee is applying that equity lens to all of our BACPB bylaws, policies, processes, et cetera. So finally, I wanted to close with an initiative that we are getting ready to launch. And it's really focused on a range of our goals that come back to the data, that come back to access, and the impacts of the social determinants of health, of racism on the social determinants of health. And that is a root cause analysis. So within the next month or two, we've been working on the launch for the last couple months, we will be launching a root cause analysis that is focused on identifying the malignant or the hot roots. We're calling this our Equity, Inclusion, and Justice Collaborative. It's under our 1BACPB initiative. And the focus will be, this is not going to be kind of a one and done kind of meeting where you jump in, you talk about some stuff, and then and that's it. This is going to be over the course of multiple months. We're asking for a commitment of time for those who choose to participate. And the focus will really be on having the discussions and asking the question, why, until we get to those hot or malignant roots, and then go from there to figure out the strategies within our locus of control as an association of behavioral health providers to dismantle those malignant portions of our root system and implement positive change. And so we have some topics that are kind of starting points that we may consider discussing, but this will be member driven, and there will be a role for kind of subject matter experts and others who aren't a member of our association to engage. And I just really want to close by, my contact information is up on the slides. I'll be sharing these slides as well. Feel free to take down my email address and I can send them. But there were just so many things already this morning that folks shared, particularly Jennifer Faison, about kind of what we're doing. And I'm just so grateful for DBHDS to provide this chance for us to come forward and kind of share. And my hope is that this will be a great springboard from which we can really, as we are all kind of working through and doing the hard work, we can do that together. And that's what our 1BACPB initiative, which is under the One Virginia, and I stole Dr. Underwood's hashtag diversity wins. It really is. We're all in this together. And thank you so much for the opportunity to be here with so many other distinguished guests. So thank you.
Thank you, Mindy. We appreciate you. And I don't think I undersold her. I told you she was passionate, and I told you she was going to come loaded with some nuggets of wisdom today. So I am really appreciative. So thank you for joining us. And so now it is my distinct privilege, honor, to introduce our keynote speaker today, Dr. Jessica Young Brown. I hope you all are ready for some dynamic and amazing wisdom to follow up on just the great presentation we just had. If you have not had an opportunity to check her out, this is going to be a real treat for you today. I know I've had a chance to look her up and see some of the great work that she's doing and get inspired. So yes, I am setting you up, Dr. Brown. So get ready, get energized. Dr. Brown is a licensed clinical psychologist and the owner of Choices to Change, LLC. Her company provides therapeutic services, consultation, and education to organizations around mental health, organizational, and other issues that people may need support. She teaches, and she's an educator. I'm not even gonna say she teaches. She is an educator. She is a program developer, and she consults in the areas of vocation development, self-care, spiritual formation. And I want you to hear that, because as people in behavioral health care, oftentimes one of the areas where we really lack is our own self-care. And if you can't pour into yourself, you will run empty trying to pour into others, particularly around this work in DEI. So she does work in leadership and working around race-based traumatic stress. She is an expert. She also is on the board of the Enrico Community Service Board. And so I am excited. I am going to turn it over to her, but I just want to say that she will leave some time following the presentation for questions and answers. However, she has advised that we can use the chat function in Zoom. Well, actually, because we do have a Q&A function here too, that we can keep our eye on. So if you want to send questions throughout the presentation, Dr. Brown is going to address those. So we are really excited about that and looking forward to this presentation. So Dr. Brown, I'm turning it over to you. Get ready.
Good morning. Good morning. Dr. Mobley is setting me up Many of you have probably encountered my shenanigans over the years. I was kind of originally introduced to the symposium 2 years ago, I think now, talking about generational trauma in African Americans. And so I'm happy to see some familiar names. I cannot see your faces. I just want to say before I share my slides that I am deeply grateful to the people who came and spoke before me, because what we see is that in our state, there are actions taking place to try to dismantle some of these oppressive systems. And that is so important to see it laid out, to see all of the strategies that we're engaged in, from the governor's mansion to community-based organizations, whether those are private or government run. And so I think it's really important that we know that whether we realize it or not, we are already engaged in this process of diversity, equity, and inclusion. And so the good thing is that the systems are set up to kind of do the right thing. What I want to invite us to do is to take a step back, maybe to take a step inward, and to think about what we need to do at the individual level and at the agency level to keep dismantling these systems. If any of us have been in organizations for more than 5 minutes, what we know is that policies are great, but people have to enact the policies, right? And so we have to figure out, once we set up these policies that really lean us toward anti-racism, towards anti-oppression, how do we then ensure that the people who are executing these policies do that in ways that are true to what we say we are? And so that's kind of what we'll talk about today. As Dr. Mobley mentioned, I will be keeping an eye on the chat, and we'll also reserve some time at the end. If you've heard me talk, you know that I tend toward rants, and so I'll do a really good job, hopefully, of keeping myself on track today. But I just look forward to engaging in a conversation with you about this material, and hopefully we'll have a great discussion. Okay. So first, I want to kind of talk to you about the goals here. We'll spend just a teeny bit of time affirming the need for DEI work, because I think what we've done this morning has already really set the stage for that in very tangible ways. I so appreciate Dr. Underwood naming structural racism as a health crisis, right? As something that infiltrates the fabric of our lives in all of these different ways. And for us as behavioral health providers in the variety of ways that we serve people, it's so important for us to understand that structural systems of oppression are ever present in the work that we do. So that stage has been set incredibly well, and I will not belabor that point. Next, I want us to kind of think through what some barriers might be to really doing DEI work. And let me be clear, we've got the policies and practices on the books and are beginning to rethink our strategies. And if that work is going to be sustainable over time, we've got to work at changing people and changing the hearts of the organizations that we work with. And so I'm going to push us a little bit on what it means to change hearts, what it means to change visions, what it means to build relationships to the extent that DEI work feels like a part of who we are, as opposed to something that we do because we know we're supposed to do it. And then finally, I'd like us to think about what it means to envision next steps. This work has no destination. There's never a time where we'll be able to sit at this symposium and say, we've done everything we need to do to eradicate all the barriers to mental health access in the state of Virginia. We're not ever going to do that, right? So when we conceptualize this equity journey as a process as opposed to a destination, then that always leaves us with more work to do. And the gift is being able to celebrate all the work that we've done. And we have great examples of that this morning, and to use that work as a launching pad for what comes next. So that's where we're headed. Okay, so why is this important? Again, I'm not gonna spend a lot of time on this because the folks who spoke before me have done such an excellent job here. But the bottom line is that systemic injustice affects the most vulnerable Virginians, and it affects all of us. What we've realized over the past 18 months is that the systems of oppression that were already in place were amplified by the COVID-19 pandemic, right? So the health inequities that already existed, the problems that we see when you have people dealing with the consequences of poverty, the issues we have related to mental health stigma and access to mental health care were all exacerbated by this pandemic. And so now our work is deeper, wider, bigger, because people are suffering. People have always been suffering, but the layers of their suffering have taken on a different magnitude. And the bottom line is that I believe at the heart of the organizations we're all a part of, whether you work at a CSB or a private agency, your organization exists because you have a desire to help people. And we can't serve all people if people don't have comparable access to our services, right? Whether that's access to insurance, whether that's being in a building that is not accessible to folks who don't have the same level of mobility, whether it's having intake forms that are only in one language when you're housed in an area where there's a large percentage of folks who have English as a second language, right? All of those kinds of things become accessibility issues. And when we look at ourselves with an equity lens, what we see is who are all the people we have opportunities to bring into the fold? Who are all the people that we can connect with or get more information about so that they can get the services they need? And that's really when we're doing the work we are supposed to be doing. So let me just provide, I know you all have heard at this point lots of definitions about these terms that we're throwing around. I'm a psychologist, so we love operational definitions. I'd love to give you all some operational definitions just for the time that we're spending together. And I think these definitions are important because diversity is not the destination. Right? Diversity is kind of a catchword. And it's a hot topic right now, as others have noted. But it's really just the beginning of what we're talking about when we talk about DEI work. So diversity means simply that everyone is present. What diversity doesn't give us information about is the power structures that govern how people behave in that room where everyone is present. It doesn't give us information about the level to which people feel they can have a say in the functioning of what happens in that room, right? And so if we're not careful, we can use diversity as a token and think that we're actually doing equity work. And so I want us to kind of challenge that notion right away. Diversity is good. We should have a diversity of people and experiences and perspectives, and just having people in the room is not enough, right? So equity is really about comparable access. It's about this idea that because people come with their different experiences, with different risk and protective factors, people who need the same service might have different pathways to get to that service. So a classic example of this is I was teaching in higher education when COVID happened, and we quickly had to move all of our classes to online. Well, that's great, right? everybody has the Zoom link for class, but there were these other equity questions that we had to ask, like, does everybody have a personal device that can be connected to the internet for the amount of time it would take to be in class? Does everyone have a private space in wherever they're staying during this pandemic where they, right? Like all of those kinds of things are equity issues. And the challenge we have is that sometimes in our heads, we have kind of a default client and we serve that default client. But equity questions push us around, one, the idea that our default client exists, and two, the idea that that default client does not represent the needs of and experiences of all the people that we serve. So equity says we have enough variation in the way the system functions so that people don't get inadvertently left out just because they can't do it the way other folks do it. That's the equity conversation. Inclusion is really about people having a meaningful say and feeling connected to the vision. So, people often kind of use the metaphor about diversity as everyone having a seat at the table, right? But inclusion is really about, does everyone get to talk when they're at the table? Does everyone feel that their experiences are respected and heard? And frankly, does everyone feel like they're a part of community? And as agencies, we have the challenge of managing this in terms of the clinical services that we provide, which is very important, right? But we also need to manage those issues at the level of the people who are working for the agency. So we're toggling these two major questions around, do people who are our employees feel a part of this community, feel empowered to be a part of the decision-making process, feel like their experiences are heard and understood? And do the people we serve have that same feeling? So take a look at this image. This image is from a resource called Dismantling Racism, which if you haven't encountered it, I encourage you to check out. And so when we talk about oppression, we're essentially talking about isms, right? Classism, racism, sexism, heterosexism, ableism, I would add to this, right? I would also add xenophobia to this list, so it's not all encompassing, right? Oppression is the ways that we inadvertently other people, right? And so a part of what we have to reckon with is that oppression is a part of our daily experience. It would be easy to sort of assign oppression to, quote, bad people, but that's not even the half of it, right? The folks who talked before me have talked about these structural ways that oppression gets played out. And so we have to reckon with the reality of oppression, but simultaneously reckon with the privileges that we have as individuals. And privilege is not just about race, it's about class, it's about ability status, it's about sexual orientation, right? And so all of us at the individual level have the work of reckoning with the privileges that we hold and the ways that we might be subject to different forms of oppression. We all have intersecting identities, right? Kimberly Crenshaw taught us that. And one of the things that we have to deal with both at the personal professional level and also at the clinical level as we're working with the people we serve is the way that oppression and privilege get internalized and then enacted in people's behaviors, right? So oppression can get internalized really as self-hate, as inferiority, and it might impact someone's ability to even seek services, right? Privilege can get internalized as superiority and look like entitlement when people say, well, that's their problem, they have to deal with it, right? Where we sort of divest from the process of dismantling these oppressive structures. And so what I'm encouraging all of us to think about is, what are the ways we engage with these ideas? How do we examine our own places of privilege? And how do we use our privilege? We can use privilege, to be a little flip about it. We can use privilege for good or for evil, right? So the opportunity we have here is to use our privilege for good and to think about how we wield privilege in service of dismantling these oppressive systems. So, as it's been said, ignoring these oppressive systems does not make them go away. And our privileges really entangle us in these systems in ways that it can be hard to tease out, right? So I am a Black woman, and many people see that as a point of oppression, which is true, right? And I'm also highly educated. I'm also cisgender. I'm also straight. I'm also able-bodied. I'm also middle class, right? And so there are all these privileges that I have where even though I hold these points of oppression, I might have a blind spot to when I'm engaging in heterosexism, right? I might have a blind spot to when I'm engaging in a classist system. I might have a blind spot to when I'm engaging in a system that disadvantages people who have a disability, right? And so to dismantle these systems is really hard work because it requires the internal work of examining the ways we might be participating in systems that we say we're fighting against. It is reflective work because it requires us to look at ourselves. And I'll speak as a psychologist, right? We are really good at looking at other people. We become experts at it. We get degrees in looking at other people and helping them. But to really do this DEI work and to be a part of organizations where this work is sustainable over time, we've got to look at ourselves too. And we've got to examine the ways that we might intentionally or unintentionally be a part of the problem sometimes. And that's okay, because we are all works in progress and we are all a part of these systems. But as so many have said before, if we don't name what's going on, we cannot shift it. We cannot do something different if we aren't able to tell the truth about what's happening. And I think especially in a state like Virginia, right, where I so appreciate Dr. Underwood talking about the legislation that has been put into place. The reason those legislations have had to be put into place is because we live in a state where oppression was a part of the economy, right? Oppression is what made the state what it is. And we can't divorce ourselves from that reality. We also can't pretend that just because it was in history, it's over or done with, right? We have to reckon with the way Indigenous communities were treated through the process of colonization. We have to reckon with the enslavement of Africans. We have to reckon with Carrie Buck and how ability status impacted her ability to make decisions about her own life, right? That is a part of our history. And it's a part of the way people show up to mental health and behavioral health treatment in our state. So we have to name it. We have to say, here are the ways that the system that we are a part of has in history not done what it was supposed to do. And when we do that, we can articulate, here are the ways we're making different decisions to move forward. So, oppression is in education, it's in healthcare and behavioral healthcare, it's in housing and transportation. There was a question in the Q&A about systemic racism and eminent domain, right? And eminent domain is one of the examples, and it's also like embedded in public policy, right? And so a part of our responsibility is to think about how these equity issues show up all around us, right? It means as individuals, we have an advocacy responsibility, but it also means at the organization level, we have to think about how our values demand that we make decisions, right? So Mindy saying that VACBP as an organization decided to take a stand on Black Lives Matter, right, is one of the ways that we can shift this conversation to really talk about how systemic oppression impacts us at multiple levels. And people are going to be able to do this in different ways because we all have our interest areas. But the key is that we have to understand what's happening. And as long as we sort of live in a sanitized reality, it makes it hard for us to do this meaningful work. Okay, so here's some agency level questions that I want you to think about. Who are the people that we privilege as a system? So of all the people who interact with your agency, who are the people who are best suited for the way you do things? And the follow-up question there is the answer to that question representative of all the people you serve? Who makes the decisions? And who deals with the consequences of those decisions? Does whatever the power structure of your agency, and all agencies have power structure, many of those power structures are hierarchical. That's just the nature of organizations, right? Hierarchy isn't necessarily bad, but sometimes hierarchy can reflect these oppressive systems that we say we're fighting against, right? What does the leadership in your organization look like? Is it representative of the people who serve in your organization and who are served by your organization? Or is it a reflection of these oppressive systems that we've been talking about? And what is the cultural reality upon which we base what is appropriate and right? Especially in mental health care, one of the things that we have to reckon with is that our medical model, the way we diagnose, the way we assess people's functioning has a cultural reality. Embedded in those ideas about what is healthy functioning and what is unhealthy functioning is a cultural value. And sometimes that value is based upon a default white, straight, middle-class, able-bodied person. That disadvantages some of the people that we serve, right? Can somebody who is undocumented safely come to your agency and get the support they need without being worried? Can somebody who's in a wheelchair get access to all the services that you provide? Is the office for your agency on the bus line, right? Like those are equity issues. And it's important that we consider who are the people we privilege. So this is a critical question. If we were to stay the same, if we don't change the status quo and we don't change anything about the way we do things, who would be harmed? Who would be left out? Who would not be able to get what they need? And this question looks different for different agencies, right? Because some of us serve particular populations, but others of us have a really broad scope and we want to serve everybody, right? So that means whatever the vision and mission of our agency is, we need to have methods that really support that. And it's all the way from the accessibility of information about your agency. It's about the policies and procedures you put in place. It's about the staff you hire. It's about the billing processes, right? All of those kinds of things are impacted when we have these conversations about equity, to the point that if you're really doing equity work on some level, it should be exhausting because of how big and wide it is, right? And that's why it's really important for us to work together and to have these conversations, both at the agency level, but also just as professionals talking with other professionals, because it will take all of us to be able to shift some of these systems. So let's talk about the individual level stuff. What do I gain when I maintain the status quo? In other words, what privileges am I enjoying right now that maybe means somebody else gets disadvantaged? What fears do I have about rocking the boat, right? And this really depends on your social location, right? In some organizations, people might have fears about talking about issues like this because they're worried about retaliation, or because they're worried about looking stupid, because they're worried about accusations that might come their way, right? There are all kinds of reasons that people might approach this with fear. And it's important to name those so we can figure out what to do with them. What am I afraid to lose? And this is, I think, a really critical question. Do I need to practice decentering my own needs and viewpoint? So because of the education that many of us have, especially for those of us who might be in positions of power, we are often in spaces where what we say goes, so to speak, right? And so for some of us, we actually might need practice just naming that our viewpoint is not the only helpful perspective. And in fact, there might be other perspectives that are relevant for us to consider and use as a point of action. And so it could be helpful to ask yourself, when's the last time I decentered my perspective and spent time listening to someone else and using their perspective as a guide for how we move forward? The other thing that's just a reality for all of us is that this is our work, right? And it can be scary to put ourselves at risk in some ways, right? The last time I did a talk like this, a conversation came up about cancel culture and how cancel culture can really keep people from sharing or being involved because there's this fear that, you know, maybe people won't trust me, or maybe I'll be accused of being a racist or whatever, right? And I have some suggestions there, but the key is we've got to figure out for ourselves what we're willing to kind of put on the line. And there's just kind of a foundational question about, yes, your agency may have these anti-racist values, but you've got to ask yourself as an individual, is this something that I care about? Do I place a personal value on being anti-racist, on dismantling oppressive systems? Because here's the thing, if it's not something that's personally important to you, it will show in the way you show up to these kinds of conversations. And so we've all got to do that internal work around asking ourselves these critical questions. So here's the reality. Change is not easy. And because we live in a world where people have differing perspectives and experiences, not everyone is going to be happy with the changes that we make, right? Some people are committed to seeing their viewpoint as sort of truth with a capital T. And so DEI work is not necessarily about making everybody happy, right? In fact, usually that won't happen. It is about making sure that people are heard and that the variety of perspectives that show up at an agency, in a meeting, in a client population are heard and respected as a part of what we do as an agency. DEI work also demands that we take a stand, right? So think about the people who came before me and the way they talked about how their agencies have made clear-cut communications about this is what we stand for. And if we stand for this, then this is how we are called to act in response to that stand, right? It means we say and then put legs on a value around, we're not going to be an agency that disadvantages people of color. We're not going to be an agency that disadvantages people who are impacted by poverty. We're not going to be an agency that disadvantages people who are not cisgender and heterosexual, right? When we take that stand, when we articulate our values, it gives us information about how we move forward. And so both at the personal level and at the agency level, the big question is, what are the values we hold true? And how can we use those values to determine the next actions? The other piece that, you know, in the world that we live in, where we love organization and structure, and we like things to be tied up in nice, neat little bows, this work is messy, right? It makes people anxious, it makes people angry, it pisses people off, it forces us to reckon with the ways we've been a part of the problem. And so if we're going to engage in this structural change, we really have to embrace the mess. We have to get to the point where we give ourselves permission to not have it all figured out, where we give ourselves permission to make mistakes, to try again. I love Mindy's comment about using the statement first draft in conversations. We've got to think about what are the ways that we can let people know, both for ourselves and for our clients and for our agency leadership, right? Like, we're just figuring this out. We don't have all the information. And it's important for us to do that work at the agency level, because many of us are serving people who are vulnerable to the extent that they might not be able to take another microaggression, right? They might not be able to take another experience where they feel unseen and unheard. And so it's important for us to do that work as agencies and individuals, because it really could be life or death for the people we serve. That's not an exaggeration. I have a private practice, and many of you, if you've heard me talk before, I always say my clinical population is Black church folks, right? So I have a lot of people who in their daily lived experience, they have mental health stigma. And I can't tell you how many times I've had someone come to me and tell me about a negative experience that they've had. And probably the vast majority of that time, the provider who was a part of that negative experience wasn't attempting to provide a disservice to the client, right? But really it boils down to perhaps ignorance, right? That people haven't taken the time to do their own research, to do their own work. And one of the things we need to keep front of mind is that this is not just an intellectual exercise. We're talking about theory, but that's not the whole of it. The whole of it is that if we don't work to dismantle these systems, people will die. People will die by suicide if they don't have access to appropriate behavioral health care. People will die if they don't know how to appropriately and completely engage with medical systems. Families will experience repeated trauma if we can't provide the services they need. It's life or death, right? And that may sound hyperbolic, but the reality is that a part of what we need to connect with is that there are actual people who need our systems to be more accessible. And there will always be people who need our assistance with accessing those systems. And so this diversity, equity, inclusion work is, yes, about making our workplaces function better. And it's also about building our capacity to serve the people who we say we want to serve. When we don't do our personal work and our agency work, we don't make space for those people to get their needs met. And so it's important that we really think about the consequences of that in meaningful ways. So I want to just leave us with some practices, some strategies to think about, and then we can take some time to address some questions or comments that people might have. So first, we've got to think about what it means to build our capacity for cultural competency. Yes, that is trainings. It's going to events like this. It's learning about the ins and outs of particular client populations and having that be a consistent part of what we do as professionals and as agencies. Building capacity for cultural competency, though, is also about relationship. It's about our ability to sit and connect with the people we seek to serve. And necessarily, if we're going to build relationship, we have to challenge those other ideas that are in our heads. What I mean by that is sometimes we are working with people who we see as very different than us in lots of ways, and maybe that difference is real. But relationship requires that we find points of connection. And cultural competency is not just about knowledge. It's about ability to understand the perspective of someone who maybe isn't like us. It's also at the agency level about working to ensure that our agency staff is representative of the people we serve, right? And so there's this sort of process-oriented piece that happens in our interactions with folks we serve, but also there's this policy level piece that really is the diversity issue, right? Around making sure that we are representative in that way. The next strategy I want to suggest is that you do your research. We've had lots of resources that have come up in the morning that I want to encourage all of us to check out. But the reality is that we cannot leave it to people who have minoritized identities to do the work of educating us about their experience. That is an unfair burden on top of people who are already burdened by systemic oppression. And so whatever our points of privilege are, it's our responsibility to do the research to learn about what it means to advocate for folks in those communities. It's our responsibility to do the research, to read the books, to go to the workshops, to attend the trainings, so that we build our own capacity for understanding how these systems of oppression impact us on a daily basis. And here's the thing, because systems of oppression are so insidious and so covert, whatever you learned in whatever way you were trained probably is not even the tip of the iceberg, right? There is a benefit to the sort of official company line being presented in a certain way. And what we know about these systems of oppression is they are not adequately outlined and explored in whatever the baseline knowledge is, right? I mean, here today, as we're having this conversation, there are people who are advocating against the teaching of critical race theory, right? Because those folks believe that it's an untruth, when really critical race theory is really about what we're talking about. It's about naming and understanding systems of oppression, right? And so we've got to seek out those resources because they may not have been presented to us. And that's something important for us to keep in mind. Next, we have to build the practice of perspective taking. There is a really important skill around acknowledging that while my beliefs are based in my truth, my beliefs are not the ultimate truth with the capital T, right? There are people who have equally valid experiences that lead them to different conclusions about the way the world works. And my responsibility is to hold on to the reality that my truth might not be the only truth. And in fact, when we talk about decentering our perspectives, right? Particularly when we're talking about our points of privilege, my responsibility in that moment as someone who is engaged in the work of dismantling oppressive systems is to ask myself, why am I so committed to my perspective being right? And how can I push back on that to hear what someone else has to say? We've got to tell the truth about history, right? So there are historical realities. There are logistical realities, right? When we think about the managed care system, that are simply just the truth about the way systems function, right? It's the truth that mental health care is stigmatized and there are particular communities that are most disadvantaged by that stigma. It's the truth that we live in a system and in a state and in a country where people don't want to talk about racism, where people don't want to talk about ableism, but those realities exist, right? And so when we tell the truth about those kinds of things, we open up space for people in those minoritized communities to tell their personal truths. And that's frankly what helps us to have these inclusion conversations. When we can hear from all of the different people who are impacted by a system or a process, that's really when we can get to a place of figuring out what we need to do to try something different, to adjust the status quo. So there's a question that says, we have a lot of trainings that refer to doing the work. How can agencies help overworked, underpaid staff find time to do the work and make space for practice in the workplace? I think that's a great question. And it really ends up becoming an equity question, right? Because for instance, if you work at an agency where you really barely have time to eat lunch, right? You could have a personal value around equity and inclusion, but when are you supposed to have the time to do that, right? And so I think first agencies have to think about how to reserve time for these conversations. That can look a couple of different ways. It could mean giving people a couple hours a week or a month to have those conversations. It could mean dedicating professional development funds so people can go to trainings and can take that time off without repercussion. It could mean setting up consultation groups or brown bag lunches as a part of the way the agency functions and governs itself to have those conversations. And so I think that looks different for each agency, right? Depending upon the structure and the kinds of work that people are doing. But you're exactly right. I mean, when we talk about our values guiding our practices, this is what we're talking about. Because here's what we know. People who have minoritized identities, right, often end up bearing the brunt of this diversity and equity work, right? So for example, we take the people who are already sort of reckoning with these systems of oppression and give them more unpaid labor on top of that, right? Whether it's a person who is gay, whether it's a person who's a person of color, right? And so what we've got to do too is make the training opportunities, the space to reckon with these things accessible to everyone. And frankly, sort of turn on its head the power structure that says that the people at the quote unquote bottom are the ones who need to do the work. So that looks different for each agency, but it's time and money, right? And so if you are in agency leadership, what I want to encourage you to do is think about how can you give folks at your agency actual space, like actual time, actual money, like taking off 2 clinical hours a week, right? To really have those conversations. Buy the books for people so they don't have to buy them themselves, right? I think those are the kinds of things we have to do. And that's a part of what equity looks and feels like. Some of the people we serve have values that are the product of structural racism and societal division. What are some resources to help us challenge false beliefs and confront racism where we see it? Not to start a fight and take a stand against it, but to encourage discussion. Yeah, I think that's a really great question. And on some level, it depends on sort of how we see our role, right? So this is really a place where you can wield your privilege. So as a straight person, I can tell somebody if they are saying things that are homophobic without cost to me in a way that somebody who's gay or lesbian or bisexual cannot, right? And so one of the ways we can wield our privilege is by taking opportunities to simply say to people, yeah, that sounds racist, or that sounds homophobic, or that sounds xenophobic, right? I think we also have to use our good judgment about whether the person is ready to hear that conversation and can be helped by that conversation. One of the big pieces, Dr. Mobley kind of highlighted the piece around self-care, right? Self-care is so important in DEI work, and we also have to try to calculate the return on investment for the energy that we spend, right? So if somebody has racist or xenophobic values, and those values are a part of the way they move through the world, right? And they're very committed to those values, I might say, yeah, I believe that to be racist, but I might kind of judge how much energy I'm going to spend trying to change this person, right? Now, that's if we're talking about a client or individual you're serving or whatever the terminology you use, right? So I think we can name things and then use our judgment about how much energy we spend working with people on how to shift some of those ideas and realities, right? And frankly, the question is the person open to the discussion and connection? If they are, go for it. And if they aren't, I think it's okay to reserve your energy for the work that is productive. Now, that's not to say that we don't call a thing a thing. If it's racist, it's racist. If it's homophobic, it's homophobic. If it's ableist, it's ableist. But we also, as a part of this work, have to manage our energy because some people are open to change and some people are not. I mean, that's just the reality of it, right? And it goes back to this idea of personal truths. I'll never forget, I had a supervisor when I was in training. I did a lot of group therapy training when I was in my Ph.D. program. And I had a supervisor who always said, racists need therapy too, right? And so that's hard for me to, on some level, it's hard for me to take in as a Black woman, right? But it might mean perhaps I'm not the best person to serve them, right? Perhaps someone else can use their privilege, who they see as like them in some ways, to have a conversation about those kinds of things. And it really depends on what our role is, because ultimately, if my role is to help this person reduce symptoms, I have to start there. But if they want to engage in a conversation about it, then let's do that. And let's have an open conversation about what it would mean to challenge some of those beliefs. What could potentially be a strategy, intervention to have this discussion and make progress with individuals who've been raised with white privilege that are simply refusing to change? Okay, so I think I addressed this. Here's the thing. We have to keep talking about it, and we have to keep having conversations. I don't often get into like Twitter battles with people, but I had somebody on Twitter say that I was choosing to view racism as systemic, that was like a personal choice that I was making that wasn't based in reality, right? And so for me, that's a person who really doesn't want to hear my perspective, right? And so I can reserve my energy for people who are willing to engage. But let's say somebody says, you know, I really don't know. It just doesn't make sense to me. And I really have a hard time with people who are saying that I didn't earn the things that I've worked for, right? That's often the conversation that comes up with white privilege. Well, the beauty of the resources that we have at our disposal is that there are resources that are best suited for those kinds of people, right? Like white fragility is written for white folks, right? It's written for people who have questions about if white supremacy is even a thing. And equity demands, right, that we're able to provide the appropriate resources for the people who need them, right? So if you have a client who is a person of color and who's been reckoning with issues of racism their whole life, they can have a different conversation than with somebody who's being introduced to this material for the first time, right? At the agency level, again, that's why it's important to have these standards that we set and policies in place, because at the agency level, at the end of the day, those people who are not willing to engage in an internal change, we at least have a policy to hold them to. And sometimes we plant the seeds and wait to see if those seeds germinate. But at the end of that's why we need both things, right? That's why we need the policies in place that demand how we act. And we want to encourage this internal work. But while we're waiting for the internal work, we keep the policies active because they keep us true to our vision. And frankly, what might happen at some of our agencies is that through the wonder of attrition, some of the people who are not interested in upholding those values decide that our agency is no longer for them. And that's okay too, because there's a place for everyone, right? So there's a comment here about, what I'm doing with the current client is to bring the conversation back to him and his own experiences with oppression, right? And so it goes back to that perspective taking piece of what are the points of connection, right? The idea of intersecting identities is such a helpful framework for all of us to hold on to, because the reality is that there are some people in the world who maybe have only privileged identities, but I hesitate to say that even, right? But all of us have points of privilege and points where we feel less than, right? Or misunderstood or unheard or put upon in some way. And those points of connections are what we use to help people understand experiences that are not their own. This is the tool that we use for perspective taking. Okay, so just real quick, some other strategies that are connected to this, right? I've talked about leveraging privilege, right? So think about how your areas of privilege are places that you can speak up for people who don't have privilege in that area, right? And in service of these equity issues, we need cultural humility. We need the humility of saying, look, I don't understand this issue, and I want to seek the wisdom of the people who do understand it. An antidote, perhaps, to cancel culture is what we call calling in, which is to say, I really was offended by what you said, but I want to believe your intentions are good. And can we talk about what it would be like to frame this in a different way, right? And then I think ultimately our responsibility is around advocacy, that when we become aware of these issues, we have a responsibility to talk about them. We have a responsibility to vote in ways that lend to these values. We have a responsibility to talk to our elected officials. We have a responsibility to engage in conversation, right? And these things are what help us to continue to change the systems and change the frameworks that we're working with. So one last question that I think is relevant. The majority of the conference has discussed needs of Black, Indigenous people of color. Could poor white population be involved in this conversation as well? And if on what level as people of color? So from my perspective, I think race sort of interacts with all of these other areas of privilege, but it's when we're talking about diversity and equity work, race is one issue, but not all of the issues, right? So poverty is another issue here. Poverty intersects with health equity issues. And so I don't necessarily think about them as labels in terms of a hierarchy, but I think the question that we can ask at any given point is, how does this person's social location shape the way they show up to the services that we're trying to provide, right? And so certainly poor white folks fall into that issue of having to deal with poverty, right? I think the complication is that in our society, we conflate poverty and race, in ways that are actually unhelpful to everyone, right? And so when we're able to name that those things are connected, but also tease out the differences in the way they show up in people's lived experience, that helps us to have a fuller discussion around issues of diversity and equity. Brian has a question in the chat that I think perhaps some of the morning panelists might be better suited to answer. I'm thinking about the slide that was presented about the CSBs that are doing good work. I've had the privilege of talking with a variety of CSBs in the area about this stuff. And so maybe some other folks in the chat can share local agencies that they feel are doing a great job. I don't want to be the holder of that question because I'm sure there are other people who might have more information. So that is about the time that we have. I think, Dr. Mobley, my hope is that, this is something that all of us can kind of chew on and think about. How do I take this back to my agency, to my personal work, and really do some things that are in service of this larger desire for equity so that people can get what they need. So I want to thank you all for engaging in the conversation and for committing the time this morning.
Thank you. First of all, I told you all, I did not oversell. I told you she would come, she would slay. So thank you so much for bringing all of that nuggets of wisdom. I actually want to thank you also for making sure that you drove home the significance of our work, the criticality of the work that we're doing in the DEI field, as well as in behavioral health care. I appreciate you. I appreciate you taking all these questions, being so insightful and thoughtful. And I really want to thank all of our speakers for the same thing, just all the information that you've been bringing today, just bringing the heat around DEI. And so I won't belabor it because I know everybody needs a break and is looking forward to lunch, but it has been exciting to have this level of expertise. And so in a moment, we're going to take a break for lunch. And so here's some of the logistics just so before we break. We're going to start promptly at 1 p.m. And you'll be greeted by our afternoon MC, which is Catherine Crosby, my colleague, who is the DEIO and Health Equity Officer at the Department of Medical Assistance Services, or DMAS, to many who know what that is. And so we're going to have an afternoon of some more great speakers. So bring your energy, bring your questions. And I want to thank you again for attending the symposium. For those of you who may not be able to join us this afternoon, on behalf of Department of Behavioral Health and Developmental Services, we have been really grateful for your partnership, your devotion to serving the public. Enjoy your lunch. Your afternoon sessions will be great. And I'll see you then. Bye-bye.